How to improve kidney function. Eating a healthy diet can help to protect and maintain your kidney or renal function. It's important to be mindful of what you eat, especially if you are suffering from kidney disease. It's been proven that what you eat can either protect or harm kidney function in the long term. For instance, one particular study published in the Journal of Endocrinology, Diabetes and Obesity has found that changing your diet can help protect and even reinforce renal function. In this video, we'll discuss a particular diet that was published in the previously mentioned study, which improved kidney function for people suffering from kidney disease. So which diet was followed in the study? The participants in the study followed a low-carb diet. The study, led by Dr. David Unwin, has debunked claims that high protein intake causes kidney damage. It has also disproved the belief that low-carb diets may lead to more cardiovascular complications. In the study, 143 adults with an average age of 61 years who were also suffering from type 2 diabetes following a low-carb diet were assessed for 2 years. The diet focuses on reducing intake of starchy or sugary foods, replacing them with vegetables, dairy from the full fat family, eggs, meat, and fish. The study found that despite aging and diabetes, most participants actually improved their renal performance after following low-carb, higher fat or protein meals. For each person who participated in this study, they saw a 9.5 kilo weight loss and an average of 21.5 mmol improvement in the diabetes measure HbA1c. Not only did they see significant improvements to blood pressure and cholesterol, but their triglycerides as well. The percentage of participants who improved their diabetes control increased from 97%, with 47% achieving drug-free remission from type 2 diabetes. Keeping your kidneys healthy is especially important if you have these risk factors, which make you more prone to kidney disease. Age. The risk of kidney disease increases with your age. As you get older, your kidneys will naturally work less well than when you were younger. Older adults also typically have 2 major health risks: diabetes and high blood pressure. It is recommended to let the doctor know if you're over the age of 60 and get regularly checked for any signs of kidney disease. Type 2 diabetes. Diabetes is the #1 risk factor for kidney problems. It accounts for 80% of all kidney disease cases, according to research done by the National Kidney Foundation. A diet that is nutritious, regular exercise, and prescription medicine can help manage diabetes and help prevent complications such as kidney disease. Out of the total approximately 35 million cases in the US, more than 55% are diagnosed with type 2 diabetes. Hypertension. Hypertension, or high blood pressure, is one of the highest contributing factors to kidney failure after type 2 diabetes. It affects an estimated 26% of the general population, and it's the leading cause of kidney disease. The American Heart Association recommends that you should keep blood pressure under control to prevent kidney disease. About 1 in 3 US adults has high blood pressure, which can lead to kidney failure if left uncontrolled. Now that we know that following a low-carb diet improves kidney function in type 2 diabetes, what are some other benefits of following a low-carb diet? Number 1, weight loss. A low-carbohydrate diet is a type of diet that restricts the intake of carbohydrates, such as sugars and grains. This restriction causes the body to use fat as its main source of fuel. This results in weight loss. Low-carbohydrate diets also get rid of excess stored water in the body, lowering insulin levels and leading to rapid weight loss in the first few weeks. In many studies, people who go low-carb do much better than those following a low-fat diet. Their hunger levels stay balanced and they can lose twice as much or even 3 times as much weight. Another study in obese adults found low-carb diets to be particularly helpful for up to 6 months, followed by a leveling off where they are nearly equivalent to standard weight loss diets. Number 2, lowers triglycerides. Triglycerides are fat molecules that circulate in your bloodstream. A high fasting triglyceride level, which is what you would have after a fast, is a well-known risk factor for heart disease. One of the main causes of high triglycerides in sedentary people is carb consumption, most significantly, sugar. When people cut down on carbs and consume more protein and fat, they typically see a dramatic drop in their blood triglycerides, while a high-carb, low-fat diet causes an increase in blood triglycerides. Number 3, lowers blood sugar levels. Having blood sugar levels at the right level is vital for our health. For those with hypoglycemia or diabetes, it can lead to a lot of health complications. The low-carb diet is a healthy way to maintain blood sugar levels and insulin production. Carbohydrates are one of the fuels that the body uses to produce glucose. When you consume carbohydrates, your blood sugar levels rise. Studies have found that when people follow a low carbohydrate diet, they lower their blood sugar levels. so going low on carbs may be a good strategy if you want to manage your blood sugar levels. Some people with diabetes who follow a low-carb diet may need to stop or reduce the amount of insulin they use. A study found that, on average, insulin levels were lowered by 40 to 50% within 3 days of starting a ketogenic diet. Number 4, lowers high blood pressure. A low-carb diet is a high-protein, high-healthy fat, and moderate carbohydrate way of eating. On this diet, carbohydrates are limited to under 100 to 130 grams per day. The idea behind this is that the body turns to fat as an energy source rather than glucose. One study found that the average person's systolic blood pressure decreases by an average of 4 millimeters of Hg on a low-carb diet. Another study found that after 10 weeks on a low-carb diet, participants' systolic blood pressure dropped an average of 8 millimeters Hg. Having high blood pressure is not only an indication of heart disease or stroke, but also leads to significant health risks, such as kidney failure. There is a correlation between low-carb eating and lower blood pressure. This can reduce your risk of those diseases and allow you to live a longer life. In conclusion, nutrition science and research has found that cutting down on carbs or switching to more of a ketogenic diet can lead to vast health benefits. One of the most popular benefits in areas like cholesterol and heart health is that when you're on a keto diet, all of your blood tests show signs of improvement. Your appetite decreases and the belly fat in your body may decrease as well. These diets can also reduce triglyceride levels and boost weight loss. There are many diets that can help you get healthier, but a low-carb diet could be the right option for you, especially if you're suffering from type 2 diabetes.